I'm Jag Singh, a professor of medicine at Harvard Medical School. I practice as a clinical electrophysiologist at Mass General Hospital and am engaged in a fair amount of research, educational activities beyond being a clinician. So I think medicine in its form right now is fairly non-sustainable. I think we're quite ineffective, inefficient, and inequitable in the way we deliver care. And a part of that is there's a fair amount of opaqueness in how the transaction between clinicians and patients occur. I think sensor-based strategies and artificial intelligence are going to totally change the way we manage patients. I think we're able to potentially do that because now we have ubiquitous data, we have unlimited connectivity, and we have massive processing power that actually allows us the possibility of bringing sensors and artificial intelligence together to actually look after our patients much better. Sensor strategies are several in form and fashion. They can be implantable strategies, they can be wearable strategies, and we know, God only knows, there are many wearable strategies which include tattoo sensors, sensors that can go in the ears, sensors that we can wear on our cufflinks and around our necks and on watches. So those are going to really change the way we actually acquire data from our patients. But we need to be able to collect that data. We need to be able to curate it, annotate it, and aggregate it and analyze it. And that's where artificial intelligence really comes into play. And I think AI-based approaches will allow us to use these sensors in the most individualized fashion to look after patients better. So I think data privacy and security issues are a concern that most people have, and I think rightly so. But I take us back to the internet era, which started in the 1990s, and I think we were very concerned that there would be privacy issues and security issues that would really hamper our lives in a big way. But we got together, we developed regulatory barriers that were able to account for those data privacy and security issues, and now all of us use the internet. Maybe it still has issues, but it's still an essential part of our lives. I think the same thing will happen with AI. Obviously, the potential problem can be manifold higher, and I think it's important that regulatory bodies and different organizations, including the FDA, really put the constraints and help us regulate this so that privacy and security issues are not an issue. So there are a number of clinical conditions, both cardiac and non-cardiac, that require prolonged monitoring. And prolonged monitoring can be quite variable. It can be for several days, can be for weeks, or could be for even months. And I think now in modern medicine at this point in time, we have the possibility of using patch monitors that allow us anything from 7 to 14 days of continuous monitoring patients. There are many elegant products, some products like SmartCardia that can allow us to actually measure many variables within these patch monitors that can help us determine if patients are going to develop arrhythmias. So when you couple patch monitors with artificial intelligence strategies, it allows you to predict which patients might actually develop atrial fibrillation in the near future, or may even develop ventricular tachycardia or cardiac arrest in the near future. So I think a combination of sensor-based strategies in patch monitors, coupled with artificial intelligence approaches, will allow us to provide better individualized care to our patients in the future. So I trained originally in India. I did my medical school in India and subsequently did my doctorate at Oxford, and then came to the US and have been in the US at Mass General Hospital for over 25 years. So I had the opportunity of really looking at healthcare from the perspective of somebody who's been involved in healthcare in 3 different continents. And I can tell you this for sure, that in none of these continents does healthcare work really well. And I think much of that is because we're not able to provide the personalized care that we really need to be able to provide. And when I was in a leadership role at Mass General Hospital, at that point in time, I felt that we really needed to integrate sensor-based approaches alongside virtual care, powered by artificial intelligence, that were integrated into our workflows that could translate into better clinical outcomes to make our patients feel better. And it was with that intent that I really got down to writing this book called Future Care, which actually brings all these parameters together. And really, the book is filled with patient stories of how care looks now and how care can potentially look. Not much of it is dystopian. I think it's much if it is actually tangible technology, things that people can relate to, and I think will be able to put into practice. So I think cardiac care is going to look quite different in the near future. There are already sensor-based approaches that can digitize the heart, both implantable and non-implantable, that is wearable sensors. I think that coupled with artificial intelligence approaches, be it conventional AI or be it generative AI, will really allow us to look after patients wherever they are, whenever they want, by whomever they want, in a very personalized way. I also feel that generative AI strategies are going to allow patients to understand their health better and look after themselves. And I think it is these self-management approaches where patients have some skin in the game that will make healthcare sustainable in the future. So I'm very optimistic about how healthcare, in particular cardiovascular care, is going to look in the next few years.